This is a video demonstration showing how to access, log in, and use the Lux Diagnostics application powered by Shadowbox. The Lux Diagnostics app is provided to automate your lab orders and results through our client web portal, securely connecting your EHR through our HIPAA-compliant app. To access the Lux Diagnostics application, double-click on the Lux Diagnostics icon located on your desktop. After clicking on the icon, a login screen will appear. Enter the username and password into the appropriate fields, and the application will authenticate the user's credentials. To skip this step in the future, the user can select Login automatically by clicking the checkbox on the login screen. The next step is to securely log into your EHR exactly as you typically would. At the top left of the screen, you will see the Lux Diagnostics logo and the Practice EHR. For this demonstration, we are using a sample EHR called Shadowbox EHR. Enter the username and password into the respective fields and select Login. Once the user logs in, the application will ask if you would like to save your credentials. If you select Yes, it will store your credentials locally and you will bypass the login screen. Please make a selection based on your practice's security policy. The EHR homepage will appear just as it normally would in any browser. To order a lab test, the user must first select a patient's name and open their chart, as they normally would in their EHR. To begin the lab ordering process, the user clicks the red Order Lab Test button in the top right-hand corner. The EHR application will shift to the left side of the screen, and the Lux Diagnostics requisition form will appear on the right side of the screen. Using the information in the patient's chart, the application will automatically populate the relevant patient information into the requisition form. This includes the patient's demographics, medications, and insurance information. All available requisition forms will appear at the top of the screen. As this is a dynamic requisition, all the information at the top of the form is static. Only the testing selection at the bottom will change as you select another test requisition. Depending on the test requisition selected at the top, the corresponding test options will appear for the user to select at the bottom. If the user needs to submit multiple orders, the user must submit multiple requisition forms. Please be mindful of any additional required information needed for the test. The user can add the appropriate diagnosis codes to the digitized requisition form by entering them manually using a comma to separate them. The user can select the desired test at the bottom of the form. The application will automatically populate a barcode sticker at the top of the requisition form. This barcode sticker will populate after the requisition is submitted, and the clinic will have the ability to print the sticker. Once the requisition form is complete, the user clicks the Submit button at the top right of the screen. If the user is assigned to a provider signature, then they are required to enter their 4-digit PIN. Once entered, the signature will populate on the provider's requisition form. There are 3 things that will happen when the user clicks Submit. First, the order is sent electronically to Lux Diagnostics. Second, a copy of the order is transferred to the patient's chart in the Documents section within the EHR. And third, a PDF version is generated to enable printing. This copy does not have to be sent to the lab. The user can now go into the Documents folder in the patient's chart and review the copy of the completed requisition form. To review pending patient results from Lux Diagnostics and to save them into the patient's chart, the user clicks on the beaker icon in the top right-hand corner of the screen. The application will display all test results that are ready for review by the practice. The application groups results into consistent and inconsistent categories designated at the top of the results window. The user also has the option to view all pending results. To open a result, the user double-clicks on the result name. If the user would like to open all results at once, then they can select Open Results one by one. After selecting a lab result from the list, a tab with the result name will appear at the top of the screen. Once the user clicks the tab, the EHR window slides to the left side of the screen, and a PDF version of the test results will appear on the right side of the screen. If the user originally placed the order through the Shadowbox-powered application, the application will automatically run a search for the patient using the order information. If the user is receiving a result that has no corresponding order in the application, or if the patient's name is misspelled or has an incorrect date of birth, then the application will request that you manually search for the patient's chart. Once in the patient's chart, the user can click Accept in the top right-hand corner to save the results into the EHR. The user may go to the Documents folder in the chart to review the accepted test results. The user can also print or download a copy of the accepted test results if needed. The user can go back to the beaker icon to review other patient test results. The application will once again display all pending results for the clinic, and the user can select another test for review. After selecting a lab result from the list, a tab with the result name will appear at the top of the screen. Once the user clicks the tab, the EHR window will once again slide to the left of the screen, and a PDF version of the test result will appear on the right side of the screen. If the user would like to delete the result from the patient's chart, then the user clicks Withdraw in the top right-hand corner. If the user clicks Withdraw, the result can still be accessed by reaching out to the lab. The user can add notations to the test results with our Sticky Note feature. This tool allows the user to call out specific findings and highlight relevant remarks about the patient. Any user viewing the results in the EHR will have access to these notations. Be sure not to cover any important information because the note cannot be moved once saved. The user can store and update their credentials for their EHR by clicking the gear icon in the top right-hand corner as shown on the screen. If the user's EHR password is updated, be sure to update in the gear within Shadowbox as well. Thank you for watching this video demonstration for ordering and accepting test results with the Lux Diagnostics application powered by Shadowbox.